Good morning and welcome to Real Women, Real Issues. I'm Ardelle Bradley, and with me this morning I have Dr. Elayne Arterbery. She is a radiation oncologist. She's going to talk to us this morning about some things that we can do to stay healthy as we get older, or even if you're young. We need to be tested, take these tests serious, and she's going to help us to know what we need to do. Good morning.
Good morning. Thanks for having me.
Thank you for coming. It's great to be here. I know we're going to start out with talking about colon cancer.
Yeah, this is a great time to talk about colorectal cancer because this is March is Colorectal Cancer Awareness Month.
Okay.
So you may see people with the blue ribbons, you know, the blue bands, and that blue is the color of Colorectal Cancer Awareness Month. And it's so important for women to get a colonoscopy, particularly after the age of 50. Most of us don't want to do it, but it's super important to do.
That was a question I was going to ask. I know we hear about men who have colon cancer. We recently had someone in the Detroit area, the general of the UAW, who passed from it, and actually my father had it. But in women, I don't know of any personally. I don't know if that's something that's common, or do we just check it because as we get older, we want to be healthy and just stay in tune?
Well, it's important after the age of 50, the incidence of colon cancer rises significantly. So you don't see people getting screened early for it, but certainly after 50, a colonoscopy at the age of 50, and then perhaps anywhere from 5 to 10 years later, depending. And sometimes not only do you find cancer, but you find precancerous conditions, like polyps or some other lesions, and it's important to take care of them.
Now, with that being said, does that always lead to cancer?
Oh, not necessarily. Sometimes the polyps are just benign and then can be removed and then get tested to see if they're cancer, and then sometimes you have frank cancer. Interestingly, sometimes colorectal cancer can be kind of asymptomatic. You don't always have rectal bleeding. You may have other symptoms, weight loss, change in your appetite, diarrhea, bloating. If you have a rectal cancer, very often it'll manifest with bleeding. But if it's higher up in the colon, you may not have any symptoms, and that's why it's important to be tested.
So it's not in women as often, as readily?
It's pretty much the same in women and men.
Oh, is it?
Yeah, a little more in men.
Now, why is it? Because we hear so much about men. I never really hear about it with women. I mean, you hear about other cancers,
you hear about breast cancer, obviously,
mostly.
yeah, but colorectal cancer is significant for women as well. Unfortunately, a lot of people don't want to go through the colonoscopy, and I think what most people are afraid of is the preparation and cleaning out the colon. That's what has everybody kind of intimidated about that. And so there's a lot of interest right now in what's called virtual colonoscopy, where you use a CAT scan to do the imaging. The dirty little secret about that is, though, you still have to do the prep, because the colon has to be clean in order for you to see it. So you don't really gain that much, and there's some controversy about reimbursement. What's new on the horizon is actually an at-home stool test called Cologuard, which you're able to do at home, send it off, and actually get information. And it's highly sensitive for detecting cancerous or precancerous conditions. It's about 92% sensitive detecting a cancer and about 69% for the precancerous lesions. So a lot of people are electing to do the at-home test under the guidance of their doctor.
So you can take the at-home test, send it away, it comes back with the results. Say if you're negative, are you good? Do you still have to go do the colorectal?
Most people recommend that if you're at moderate risk, you probably still should follow up, but at least you have some assurance that it's likely that you don't have cancer. The interesting thing is it's approved by Medicare, so Medicare pays for the test. So this is sort of where we're getting into personalized medicine, where people can sort of take some ownership of their cancer care. And for those who refuse to get a colonoscopy, you know, this is a reasonable thing to do.
It's easy.
Right, and insurance is paying for it.
All right. Just hold on to that thought. We'll be right back. But first, we're going to go to Jungle Juice to hear about all the benefits in juicing.
Jungle Juice Bar offers a wide range of fresh fruit and vegetable smoothie and raw juice blends made with 100% real juice. At Jungle Juice Bar, you can rest assured that there are no preservatives or additives included in our drinks. Enjoy our unique flavor combinations, along with gluten-free, vegan, and vegetarian options. In celebration of the jungles of the world and as part of our commitment to the environment, we have dedicated some of our drinks to the jungles by giving them names of those famous jungles. Each time someone orders a drink, we are reminded of the life given to us by the jungle. Stop by and enjoy a delicious juice or smoothie today. The Jungle Juice Bar is located on Charlevoix in Grosse Pointe Park.
When you're having a heart attack, this is how it feels to your heart. And if it happens at night or on the weekend, there's only one hospital team standing by on site to save you. Cardio Team 1, only at the DMC.
I'm Ken Gross, host of Law and Reality, with an important message. Simasco Law and Thavgros are hosting a free seminar, Preventing Senior Citizen Financial Abuse. Benny Napoleon, Kim Worthy's response team, elder law expert Pat Samasco, and I will speak, and Detroit watchdog Steve Hood will be our MC. It's about preserving and protecting your income. Join us Saturday morning, May 30th, 10:30 to 12:30 at Greater Grace Temple. For free tickets, call 888-235-HELP. That's 888-235-HELP, or register at cannotaffordtolose.com.
My friends, I want to introduce you to Samasco Financial. As attorneys, they worked hard to protect clients on a legal basis, only to watch many lose their money in the unpredictable and risky stock market. Samasco Financial has recognized the need for asset protection for our seniors and has introduced investment planning that will grow your nest egg without the risk of loss. To find out more about how Samasco Financial can protect your financial future, call 586-493-9989.
Groundbreaking. Life-saving. History-making. The new DMC Heart Hospital, summer 2014. The beat goes on.
Real Women, Real Issues is brought to you by Mike's Fresh Market.
Welcome back to Real Women, Real Issues. I'm Ardelle Bradley, and we were talking with Dr. Elayne Arterbery about cancer, colon cancer, things you should do to prepare yourself in case you have a test that comes back, and how you can test yourself at home. Yeah. Thank you again. I want to talk to you now. We were talking about colon cancer before, but I'm going to shift it to breast cancer. You're doing some exciting things with that, and I want to hear about them.
There's so much going on. I'm so happy to be able to talk a little bit about breast cancer. And breast cancer in women is a very common finding. They say if you live to be 85, 1 out of 8 women will get breast cancer. Yes, and it's a particularly difficult problem in the African American community, where women are being diagnosed younger, and they're being diagnosed with a more aggressive, sort of triple negative breast cancer. So that has a more difficult to treat, has a higher recurrence rate. So it's particularly important for African American women to get screened. And I'm part of a group that's looking at a study, looking at a blood test to help detect breast cancer. And at this point, the test is about 95% sensitive. It seems to be independent of the density of the breast. So, which is important, particularly for younger women who have a dense breast.
It's harder to detect.
This test, in conjunction with mammogram, can help detect whether or not you might have a malignancy with high degrees of sensitivity. Currently, it's in the clinical trial stage, but by the end of the year, the test will be commercially available. And the expectation is this test will be available to women across the world, and it won't necessarily have to be, restricted to certain people. It'll be available and affordable.
And one thing about mammograms, typically your insurance doesn't pay for it unless you're 40 and over.
Right.
So if there's someone younger than 40, it doesn't take you away from being able to.
Oh no, it doesn't take away anything.
Right.
And the way it works is that the test gives you a range, sort of a probability. So if your mammogram is negative and the test is negative, you're good. If your mammogram is negative and the test is positive, then that's going to lead to more aggressive imaging. Instead of coming back in a year, you might come back in 3 or 4 months and get additional testing until the cancer is detected. So that's the beauty of it.
Have they done any research, or have you found it to be true that cancer is hereditary?
Oh yeah, but it's really a low percentage of people that actually have a hereditary cancer where you can prove it on blood tests, where they have a gene, a defective gene. But the vast majority of women have no family history. It's like only 20% or less that actually have a strong family history, leading to a cancer. So with blood testing, the test is called DetectDx. It's by Provista Diagnostics. It's a startup firm in Arizona. And so with blood testing, in addition to mammogram, now you have more power to help determine how often to image people. And that's really the issue.
It's interesting you say that. When I went to have my physical recently, my doctor asked me about the people happened to be in her office that day taking the blood test. And I do have cancer in my family, but I opted not to take it.
Really?
I did. So I guess that's not.
Well, again, the genetic testing for breast cancer is really used when women already have a cancer diagnosis. It can lead to information about their risk of ovarian cancer. It can lead to information about potentially their risk of colon cancer. So for a woman who's already diagnosed, that's probably a reasonable thing to do, to do genetic testing.
These women were taking your blood, and then they would tell you if you are more susceptible, if you're going to have it.
Oh, okay, so it was a study.
And I didn't want that.
Oh, well, that's the whole thing. We're so afraid to participate in studies. But a lot of the studies now are really looking at the standard treatment plus something else. So you're really, in participating in clinical trials, we shouldn't have the fear that we used to have.
I thought, that information you tell me, you're 90% chance you're going to have cancer.
You didn't want to know?
I didn't want to know that then. If I take my mammogram and I have it, I'll deal with it then.
You'll deal with it then, exactly.
And I'm not telling that's the right thing to do. That's
No,
just what
everybody
I
has a
opted to
personal
do.
preference
Right,
on this.
right.
I think what the way testing is going now, it's to add to the mammogram. It's sort of
Okay.
like the men. They have the PSA to help
Exactly.
determine whether or not they might have prostate
they
cancer.
are.
The women, we don't have anything.
We
so at
don't.
least we have a blood test to be used along with the physical, along with the mammogram, to help determine whether or not there's a benefit to do additional testing, or if maybe we have a potential for having cancer.
Right. Well, thank you, Miss Elayne, for
Oh,
coming.
it's such a pleasure to be here.
Every time you come, there's more and more questions I need to ask of you, but we'll have to have you back
Oh, I'd love to come back.
so we can dive into this more.
Thank you so much.
Thank you for coming. And thank you for tuning in. Stay tuned. We'll be right back after this.
Visit loverslane.com for the boutique store near